Can you please describe what you see in this video?
Yes, it's a child who looks, it's a teenager who most likely who looks well alert and well grown for his age, and he's having opacity as well, and having characteristic features which are suggestive of Cushingoid features, and he's having hypertrichosis as well on the back, and um, this uh, uh, yeah
Okay. So diagnosis, what you are keeping?
Cushing syndrome.
Yes. So in this video, what I say, I can say teenage girl who is maybe stable because stable. Yes, there is no device attached. The child is overweight. We can say overweight or obese, and also we notice that she is in the form of like double chin. There is the abdomen is large abdomen, stria in the abdomen, and the skin are thin and shiny, and also excessive hair like mosaic hirsutism on the back. There is excessive hair on the tongue. We are seeing some candidiasis. Okay. So this is a features that is consist of Cushingoid features. We'll mention Cushingoid features, not Cushing syndrome. Okay, Cushingoid features. Other DD it can be we keep like iatrogenic or endogenous. Other causes of obesity, hypothyroidism, pseudo-hypoparathyroidism, and panhypopituitarism. So same in Cushing syndrome, it comes on clinical or in history. So DD will keep same when they ask what you find, tell and DD. So first we mention the Cushingoid features, then iatrogenic or endogenous, other causes of obesity, then hypothyroidism, pseudohypoparathyroidism, and panhypopituitarism. So, what are the history we ask? Suppose it is a Cushing gout features, Cushing syndrome.
Yes, I would like to ask about the onset, course, and duration, and when exactly did she notice? First, it starts to happen when she having increased her weight when it got started, and eating habits as well as is it related to any long-term conditions like asthma or chronic steroid use, or is it related to any kidney conditions, long-term kidney conditions like nephrotic syndrome, and using long-term steroids with that, and any hormonal imbalances she's having, history regarding PCOS.
Okay. So, the history when we take in video station, we keep in our mind diagnosis and the DD. Then easily we targeting this. First, as usual, any history, onset, course, and duration, what increase and what decrease. Then it's obesity. So, nutritional history and its lifestyle, level of exercise. Any special features, mentality. We know obesity patient associated with syndromic or dysmorphic features. So any special features, mentality, submental or not. Then chronic condition, lots of chronic condition we take steroid and steroid side effects also called. So the chronic illness like nephrotic syndrome, SLE, asthma, JIA, even chronic ITP, these are steroid intake or any history. Then hypothyroidism we are keeping as obese DD. So school performance, attendance and bullying, pubertal history, then skin discoloration, color and site, acne and hair distribution. So acne hair distributions we are seeing pushing weight features. Then obesity associated with diabetes. So tummy size, any nocturnal enuresis, proteinuria. Proteinuria means proteinuria. Nephrotic syndrome we find proteinuria. So proteinuria. Then obstructive sleep apnea is a complication of obesity. So ask about the snoring at night, palpitation, chest pain on activity. Then any abnormal gait, joint pain, sign of increased intracranial pressure, headache, vision problem, any family member with the same conditions or chronic disease. So family member with the same condition because we know obesity is a family history sometimes. So what examination we do? Suppose it is a Cushing gut features or any obese child.
Yes, I would like to do the examination from head to toe and general examination regarding any skin atrophy, any proximal muscle myopathy. I would like to look for the axillary hair for secondary signs of puberty, and head and neck. I would like to check for any acne, hirsutism, moon face, alopecia, malar rash, mouth ulcers, and chest and abdomen examination. I would like to inspect the stria bruises, and Auscultation, maybe it's as underlying cause, maybe asthma, and back exam, maybe, musculoskeletal examination for the interscapular pad of fat and spinal deformity and stria, like scoliosis. Yeah.
Okay. So actually, what I finding that is not like respiratory examination, then understand including that what, because we are not getting that much time. Like on skin examination, what I am finding. Sometimes I also manage. So any examination, first airway breathing circulation, we know that vital, especially blood pressures, oxygen saturation, random blood sugar, obesity complication. Keep in your mind, obstructive sleep apnea. So oxygen saturation or RBS, BMI must weight because it is a high weight patient. So take the full measurement, weight, height, and BMI, plot on appropriate sentence. Then pubertal assessment, tenor staging, vision and visual field, general examination for sign of steroid toxicity, general examination for rash, skin conditions, sign of steroid toxicity, then abdominal, cardiac examination, respiratory, MSK, neurological examination. Abdominal examinations, we are seeing that there is tria, we find cardiac examination because obstructive sleep apnea complication from obstructive sleep apnea, pulmonary hypertension, or pulmonary develop, respiratory, again OSA come. If OSA, we keep in our mind, we can keep like polysomnography, sleep study, lots of history we are taking. Suppose so it is a Cushing features, what investigation we do?
Yes, midnight salivary cortisol and 24-hour urinary cortisol, and ACTH levels, and low dose dexamethasone suppression test, and high dose dexamethasone suppression test.
Yes, yes. So some are confirmatory, some are basic work of the obesity. So first confirmatory of Cushing diagnostic like midnight salivary cortisol and 24-hour urinary cortisol, low dose dexamethasone suppression test and high dexamethasone suppression test. So these are confirmatory: midnight salivary cortisol, 24-hour urinary cortisol, low dose dexamethasone suppression test, high dose dexamethasone suppression test. Then the basic workup, basic like random blood sugar, is obese child, HbA1c for diabetes, liver function test, renal function test, lipid profile, sex hormones and MRI brain, abdominal ultrasound, echo, sleep study, fundus examinations, hip X-ray for sleep upper femoral epiphysis. We know that SUFI is a complications of obese child. So how can you manage? What is the multidisciplinary team you involve? Tell me.
Yes, I would like to involve my consultant along with this, the endocrinologist, and rheumatologist, and also dietitian and
Yes.
nutritionist.
So the diagnosis and complication, if we keep in our mind, first my consultant pediatricians, endocrinologist because it is endocrine problems, then dietitian, obese child, support dietitian, of course I do. I tell the complication obstetric sleep apnea. So pulmonologist plus cardiologist, OS complication is pulmonary hypertension. Keep it in your mind. Then we go
Yeah.
the cognitive behavior therapy because the obesity, we bullying, psychologically upset, the child can be depressed. Depression is one of the side effects of steroid also. ENT and nose throat, ENT throat. Then ophthalmology, eye examinations, and two things that is lies with the school and psychological support to the family or family counseling is needed. So this is some advice we give again. That is lifestyle modifications for all and the child, nutritional advice for healthy food and more exercise. So lifestyle modification advice we are giving, nutritional dieting, health you will take, and exercise more. And the causes of headache occur in Cushing syndrome, pseudomotor cerebri, hypertension, side effect of the steroid, and central cause. So this is one thing is that the type of Cushing syndrome stria is stria rubra. That is stretch mark due to thinning of the skin. That is called stria rubra. Other stria alba, stria atropicans. So remember, stria rubra is the what is we are seeing for the thinning of the skin. So this is all about Cushingoid features. Thank you for your participation.